Welcome to EZI Nurse, where nursing education made easy. In this session, we will discuss the most important question that will come in exam. Okay, there is a 90% chance that this question will come in exam, and if you off guard this question, you definitely not gonna pass. So let's get dive into the session. So in this session, we will discuss about physiology, okay, and based on the system we will discuss the most important topic. So our first topic is the functions of the kidney. Now as we know, kidney is a part of our urinary system which filtrates our blood and plasma. Okay, so mainly they will filtrate the excretory factors, okay, different type of waste products from our body, okay, and if we specifically say, they will filtrate our blood. Okay, so what are the functions of the kidney? So first, to know that, first we have to see where the kidney is placed. Okay, so kidney is placed just in front of the liver, okay, and there are two kidneys in our body. As you can see here, this is our urinary system. So in urinary system there are two kidneys, okay, then urinary bladder will be there, ureter, urethra, and the kidneys are placed on right and left. So the first function is filtration of blood, and this is the main and important function of the kidney. In this, the kidney will filtrate the waste products from our body and it will excrete through the urine. Okay, so the kidney mainly filter the waste product, excess fluid and electrolytes from the blood, okay, and remove it from the body through the urine. The next one is regulation of electrolyte balance, as it is maintaining the waste product as well as it is maintaining the electrolytes that is present in our body. This helps to maintain a balance of electrolytes like sodium, potassium and also calcium. Okay, so these are the main electrolytes that it's maintaining. Next is acid-base balance. Okay, so now if we look after the acid-base balance, it is mainly maintained by our lungs and kidney function. So the 40% of the acid-base balance will be maintained by the kidney. So kidneys regulate the blood pH by excreting hydrogen ions and reabsorbing the bicarbonates. Then the fluid balance, okay, so how they are maintaining the fluid balance? Kidney is filtrating the blood and removing it through the urine. Okay, so the fluid is going through the body outside, so the balance of the fluid in between the body will be maintained by the kidney. The control of the body's water balance is by adjusting the concentration and volume of the urine. Then waste removal, like kidneys remove the waste products such as urea, as I told, okay, then creatinine and different kind of toxin that is present in the blood. Then the blood pressure regulation. Now how it will possible? By releasing the enzyme which is renin. Okay, kidneys helps to regulate blood pressure through the renin, angiotensin and aldosterone system, okay, which is also called as RAS system. Then we have the next function is erythropoietin production. Now what is erythropoietin? This helps to reproduce the blood cells. Okay, erythropoietin produce, it is a hormone that stimulates the red blood cell production. Okay, it's not produced, but it will help to increase the production of the blood cell, okay, by giving the production of the bone marrow. Okay, then we have the regulation of the calcium and phosphate. The kidney converts vitamin D and it will active the vitamin D in our body, because when the vitamin D we are consuming, that will not be activated, okay, that will not present in the activated form. So kidney is the main part of our body which will active the vitamin D. Then we have detoxification, as it is filtering our body certain drugs, and if we are taking certain kind of drugs, the filtration will be done by the kidney. So these are the main functions of kidney. Now we will move on to the functions of heart. So one of the most important organ in our body is heart. Okay, so what are the things the heart will do? First one, as we know, the heartbeat, heart rate, okay, the rhythm of the heart, the circulation of the blood will be done by the heart. So let's see that what are the main function of this. So first one is pumping blood. So what is that? The heart will pump oxygenated blood to the body and deoxygenated blood to the lungs. Okay, so what the heart will do is, heart will pump blood, okay, oxygenated blood, and it will send to all over the body, cells, tissues and different kind of organ to carry out the oxygen and to give the oxygen to the different kind of organs, and it will regulate the deoxygenated blood to the lungs to again to conceive or again to retrain or make the deoxygenated blood in oxygenated blood. Then oxygen and nutrient delivery. As we know, the heart will pump blood, and through the blood what it will do is, the blood will go everywhere, right, in every part of the body, and through the blood it will supply oxygen and different kind of essential nutrients to the body, okay, and different kind of organs. Then the removal of the waste products. It helps to remove the carbon dioxide and the metabolic waste products from the body. Okay, then we have maintaining blood pressure. Okay, so there is an amount of blood that in each and every second or each and every minute in a time period heart is pumping. Okay, so by that the heart generates the force that is needed to circulate the blood and maintain the blood pressure in our body. Okay, so our normal blood pressure is 120 by 80 mm of Hg. Okay, for adults. Then regulating the blood flow. Now by adjusting its rate and the strength of the blood flow, okay, and again the concentration, the heart regulates the blood flow to meet the body's need. Okay, so based on the concentration and how blood is pumping, bodies, most of all of the functions are dependent. Then transport the hormones. Okay, so not only nutrients or oxygen, also it aids to distribution of hormones through the body by pumping the blood. Then we have thermoregulation, okay, which is maintaining the temperature, homeostasis of our body. And the last one is electrolyte balance. The heart function is influenced by the helps to regulate the electrolyte levels, especially potassium and calcium. Okay, so these are the main and important functions of heart. Next, we will move on to the cardiac cycle, which is very important. Now, what is cardiac cycle actually means? The cardiac cycle is the sequence of events in one complete heartbeat. So, the starting of the pumping blood and in between which time period one beat or one heartbeat is completing is called as cardiac cycle. Okay, so the cardiac cycle is the sequence of events in one complete heartbeat. Okay, so this is the main definition, okay, which is consisting of contraction of and the relaxation phase. Okay, so from one contraction to one relaxation phase, okay, what are the steps are involving in a one sequence to make a heartbeat, that is called as cardiac cycle. So the cycle ensures the continuous blood circulation, okay, and alternating between the contraction, which is called as systole, and the relaxation, which is called as diastole. Now this systole and diastole is there in the pressure of our blood, or we measure as a blood pressure. Okay, so it lasts about 0.8 seconds. So one heartbeat is taking 0.8 seconds with a normal heart rate of 60 to 100 beats per minute. Okay, so if some person's heartbeat is in between 60 to 100, so their one beat will take 0.8 second. Okay, so the time period will be 0.8 second. Okay, if the heart rate is 60 to 100 beat per minute. This is very important to remember. This can also come in exam, okay, because as a maybe multiple choice question, or it can also come for 2 marks question. Okay, so cardiac cycle definition is very important. Okay, so here is a brief overview I have given. So let's just see what are the things. First one is arterial systole. Now, as I told, the systole mean is the contraction. Okay, so as we know, there are 2 arteries and 2 ventricles. Okay, so if we see heart as a box, Okay, if we see heart as a box, the arteries will be here and the ventricles will be here. Okay, right artery, right ventricle, and left artery, left ventricle. Okay, so the arterial systole, the arteria contracts and pushing the blood into the ventricles. Okay, and through the ventricles it open in atrioventricular valves. Okay, through the atrioventricular valves the artery's blood will be pushed and it will go to the ventricles, that is arterial systole. Next, ventricular systole. What is that? Now again the ventricle will be contract. Okay, the ventricle contraction will be there, which is called as isovolumetric contraction. Okay, then it increasing pressure but not yet enough to open the cellular valves, which is also called as aortic and pulmonary valves. All valves are closed, then the volume remains constant. Okay, then the ejection phase. Okay, so in the ventricular systole two phases will be there, isovolumetric contraction and ejection phase. So the next one is ejection phase. Now what will happen? The ventricular contraction will be there. Okay, the ventricular pressure will be there, which will exceed the pressure in the aorta and pulmonary artery. The cellular valves will be open and the blood will be ejected into the arteries, and through the arteries it will go to the lungs to collect the oxygen. Okay, so that is the atrial systole and ventricular systole. Next we will come to the ventricular diastole. Now what is that? The ventricular diastole is a isovolumetric relaxation. Okay, in which the ventricles will relax and pressure drops. Okay, so the ventricle will be relaxed. Okay, it will be expand. Okay, not contraction but expandation. Okay, the ventricle will be relaxed and the pressure will be drop. Okay, the blood pressure which was creating be made in the arteries, the pressure will be reduced. Okay, and the cellular valves will close to the prevent the backflow, and but the atrioventricles valves will remain closed, so that in the filling phase, when the ventricular pressure will fall below the arterial pressure, the AV valves will open and the blood will passively from the arteria to the ventricles and filling them, and it will go to the all body with collecting the oxygen. Okay, then complete diastole, which is both the artery and ventricle will be relaxed phase. Okay, and the heart chambers will fill with the blood and preparation of the next cycle. Okay, so the same cycle will repeat again for the next heartbeat. Okay, so in each heartbeat this same cycle will be circulating. So this is the very important point which you should have to remember. Okay, so this is the most important question which will definitely come in the exams. Okay, so next we have the internal and external respiration. In the respiratory system, if we see, there are upper respiratory tract and lower respiratory tract. So from that respiratory system, in the physiological question, this is the main question. Okay, so the respiration is the biochemical process. Okay, it's a biochemical process by which the cells convert nutrients into energy, and it is using by the oxygen to produce the carbon dioxide as a waste product. Okay, so what is happening in this respiration? The respiration is a biochemical process in which the cells are producing the waste product, okay, through the oxygen and producing the carbon dioxide as a waste product. Okay, so in internal respiration, what is happening? First one is the location where it is happening. It is happening in the occurs in the body tissues. Okay, then the process, how it is happening? It involves the exchange of gases between the blood in the capillaries and the body cells. Okay, then the gas exchange, okay, with oxygen, carbon dioxide will be exchanged. Okay, if the oxygenated blood will come into the cells, it will be replaced by the deoxygenated blood which is produced by the cells with the help of the oxygen as a waste product. Okay, so that is gas exchange. Then purpose, what is the purpose of this? It provides the oxygen to the cells for the cellular respiration, okay, and energy production. and also it removes the carbon dioxide as a waste product of a metabolism, okay, or chemical reaction of the cells. Then oxygen utilized by the cell for metabolic process. So what is the importance of this? Because every cell, for every human cells will need oxygen to live, right? So for that, the cells are utilizing the oxygen for the metabolic processes. The next one is carbon dioxide, which will released by the cells as a form of the byproduct of the metabolism into the bloodstream. Now, external respiration. So external respiration is mainly occurs in the lungs, okay. Location is occurs in the lungs. Then the process, how it is processing. So it involves exchange of gases in between the air of alveoli and blood pressure pulmonary capillaries. So we are breathing in, we are taking the oxygens, and it is storing in the alveoli. Then when the deoxygenated blood is coming in the lungs, okay, deoxygenated blood is coming in the lungs, that with that blood, the blood will take the oxygen and make it as oxygenated blood, and the carbon dioxide will be released by the lungs, okay. So that is the process. Then gas exchange, as I told, the oxygen will diffuse from the alveoli into the blood, while the carbon dioxide will be diffused from the blood into the alveoli, which will be exhaled, okay, through the respiration. Then purpose, what is the purpose of the external respiration? The oxygenated blood removes the carbon dioxide from the body, which is the waste product of the body, okay. Then it will produce two things, okay, oxygen and carbon dioxide. So oxygen will be taken by the blood, okay, blood from the air in the lungs, and the carbon dioxide will be expelled from the body via expiration, okay. So this is the main function or main mechanism of our respiration, okay, which we have two parts, that is internal respiration and external respiration, okay. So the next most important topic is reabsorption and secretion at the renal tubules. Now, as we know, what were the functions of kidney was to filtrate the blood, purify the blood, okay, and to maintain the concentration, hormonal regulation, okay. So that is the function of kidney. Now in the kidneys, the tubules will be there in the nephrons, okay, and that have different kind of function, which is reabsorption and secretion, okay. So before the body will throw out the urine, again it will go through the tubules to understand whether the concentration is perfect or not, or whether the excess product is there. If is the extra waste product is there, that waste product will again be inserted in the urine, and then the urine will pass out via the body, okay. So first one is tubular absorption. So what is that? The process by which substances are reabsorbed from the renal tubules back into the bloodstream. So as I told, see, if it's kidney, okay, and nephron, as we know, nephrons is the most important unit, okay, it is the unit of the kidney, okay. What's happening? Through this capsule, okay, through the Bowman's capsule, when the blood is filtrated and going into the tubules, what tubules are doing is, tubules are making sure whether the important nutrients are passing through the urine or not. If the important nutrients also being wasted through the urine, what they are doing is, they will absorb the nutrients again and they will pass it to the bloodstream, okay, which is called as tubular reabsorption, okay. And what is the location? That primary occurs in the proximal convoluted tubule with some of the loop of Henle and distal convoluted tubuli and collecting dust, okay. So if you want to read this, you can go for the anatomy video, okay. Anatomical explanation I already have given, okay. So the substances which will be reabsorbed by the tubules will be water, electrolyte, okay. In electrolyte, main electrolytes will be sodium, potassium and calcium. Then we have glucose and amino acids, okay, and bicarbonates. So these are the main substances that will be reabsorbed through the tubules. Then mechanism, what is the mechanism? How it is happening. So by the passive transport, diffusion of the water and solubles, okay, which is urea, then active transport will occur, which requires energy to remove the solute again in the concentration gradient, like sodium ions. And the facilitated diffusion, which is used to carry the proteins and the transport of the certain molecules such as glucose. Okay, so these are the mechanism. Okay, so three things are going on in this process, that is passive transport, active transport, and facilitate diffusion. And in the last, what is the importance of this mechanism? It helps to maintain the homeostasis or the balance by regulating the fluid and electrolyte balance in ensuring essential nutrients are retained or be present in the body. So this is the tubular reabsorption. Next we have is tubular secretion. Now what is that? The definition says it is the process by which the substances are secreted from the blood into the renal tubules for excretion in urine. Okay, so now here what happening is the waste product, okay, that is not needed in blood, that product is excreting, okay, or extracting by the tubules and put it in the urine. Okay, so tubules are taking waste products from the blood and throw it through the urine. So where is the location? The mainly occurs in the proximal distal convoluted tubules. Okay, so what are the substance that been secreted from the blood is urea, creatinine, drugs, and different kind of toxin which is not good for health. Then hydrogen ions for acid base balance, to maintain the acid base balance of the body. Okay, and creatinine is the most dangerous or harmful substance. If someone kidney is failed, okay, or kidney is not working properly, this creatinine level will be increased and that will make the blood toxic. Okay, so this is the main culprit, or we can say main component that creating the kidney failure. Okay, so that are the substance that been secreted. So next one is mechanism. In mechanism we have two steps, that is active transport and facilitated diffusion. Here the passive transport will not be present. So in the active transport, the movement of the substance against the concentration gradient, often using the specific transporter. So what is mean by that? See, if it is a fluid where the concentration is more, and if it is a fluid the concentration is less, now what happen is the gradient, like the fluid will move here to this one. Okay, so this is kind of a filtration also, you can say. Okay, so that is active transport. Now the facilitated diffusion, the transport of certain substances via the carrier protein. Okay, so that is the mechanism of the tubular secretion. Next we have is the importance. What is the importance of this function is it plays a key role in eliminating the waste products and regulating the pH of the body by maintaining and controlling the hydrogen and bicarbonate ions. Okay, then the tubular reabsorption, which is returns useful for substance to filtrate into the blood, so the blood will be purified. Okay, then tubular secretion, which is eliminates the waste and excess substance which is not needed in the bloods and make the blood pure into the filtrate. Okay, so this is the main functions of the tubular secretion. Next we will move on to the functions of hypothalamus. So if you can see the brain, the hypothalamus is just present here. Okay, and it is controlling most of the functions in our body. So first function is the regulating body temperature or maintaining the normal body temperature. Okay, so hypothalamus detect the changes in the body temperature and it initiate the response, maintaining it a normal body temperature. Then control of hunger and thirst. Okay, so the feeling of hunger or emptiness in the stomach or feeling of thirsty, it is that sensation will be regulated by the hypothalamus. It's regulated the appetite, the thirst by the regulation of nutrients level and the hydration status, which influencing the eating and drinking process. Next we have is circadian rhythms. Now, what is the circadian rhythms? Circadian rhythms are the hypothalamus that helps to regulate the body's internal clock, influencing the sleep-wake cycles, other biological rhythms. So, hypothalamus will regulate different kind of cycles. In that, the main one is the sleeping cycle. Okay, when we will sleep, when we will wake up. Okay, this is maintained by the hypothalamus. Okay, sometimes it will come for 5 marks question. Okay, so remember to read it and to remember the main points at least. Okay, so that you can easily able to explain if it is come in the exam. Okay, so that is the circadian rhythms. Next we will move on to the endocrine system regulation. So as we know, endocrine system is a hormonal system. Okay, and it produces different kind of enzymes and hormones which help us, our body, to regulate and do different kind of functions. Okay, and so what it is doing is it is controlling the pituitary glands hormone release, which is affecting the growth, metabolism rate, and the stress response and reproductive function. Stress response as the adrenaline. Okay, then growth, it's affecting growth as well, like growth hormones it is releasing. Okay, helps to releasing. Okay, then a different kind of reproductive function as well will be controlled by the regulation of the endocrine system through the hypothalamus. The next one is autonomic nervous system regulation, which is the hypothalamus will influence the autonomic nervous system and it will regulate our heart rate, blood pressure, as well as the digestive process. Okay, then the emotional response. Now, as I told, they are able to manage, like hypothalamus is able to manage the stress releasing hormone. What it does is it plays a role in emotional response. Okay, by interacting with the limbic system, influencing feelings of pleasure, aggression, and fear. Okay, so the maturity of the sexual behavior and the reproduction is done by the hypothalamus. The hypothalamus will regulate the sexual behavior and reproductive function. It includes the menstrual cycle in women and maintaining different kind of sexual behaviors. Okay, and in the last we have the control of the stress response. As I told, it triggers the hypothalamic pituitary adrenal or HPA. Okay, it acts in response to stress, which is leading to the release the stress hormone like cortisol. Okay, so it helps to regulate the HPA or hypothalamic pituitary adrenal, and by that it is controlling the stress releasing hormone or the stress hormone, which is as like cortisol. Okay, so these are the main functions of hypothalamus. The next important question is pain pathway. So if any kind of trauma we are going through, okay, the feeling of that pain, how it is producing and how we are responding by it is a pain pathway. The pathway of the pain detailing how the pain signals and transmitted from the site of injury to the brain and how the brain will respond to the pain. Okay, the first step is the non-receptors activation. Okay, so what is that? The pain begins with the non-receptors or the pain receptors, okay, which are activated by the harmful stimuli, example as the mechanical injury, extreme temperature, or the chemical irritants. If you see here, this is our brain, okay, and this is the non-noxious stimuli. Consider it as the creation of the pain, okay, or the main cause, okay. So this stimuli will be transduction, or the pain induction will go through this and the nerve will receive it, the receptors, and it will go through the spinal cord, okay, where the dorsal horn cell will receive it and send it to the brain. Now brain will send this one, and through the modulation and through the spinal cord the response will come to the body. So that is the non-receptors activation. Next, after that, the transaction will happen. Now what is that? The nocipitors will convert the harmful stimuli into the electrical signals, which is the action potential through a process called as transduction. Okay, next is transmission, in which the electrical signals will travel along afferent the nerve fibers. Now this, as we know, these electrical signals are made by the transduction, okay, made through the transduction by the non-receptors, okay, and it is called as the nerve fibers is A delta and C fibers, okay, towards the spinal cord. So it is this electrical signals will go through the spinal cord, okay, and the A delta fiber will transmit the sharp and localize the pain, while C fibers will transmit the dull and throbbing pain. Okay, so two type of fibers are there, okay, one is A delta and the second one is C fiber. So any kind of sharp pain, okay, sharp pain and which is very localized type of pain, that will be transmitted to the spinal cord through the A delta, and by the C fibers what happening is any kind of dull pain, okay, non-localized pain, okay, like any kind of stomach pain or back pain, okay, which will be transmitted by the C fibers, okay. So this is the transmission of pain. Then we have spinal processing. Now already spinal cord is received the electrical signal. Now what is happening is the pain signals will enter the spinal cord through the dorsal horn, okay. This is very important. So the spinal cord, in the spinal cord, how it is, how the pain sensation is entering by the dorsal horn. The synapse will second order neurons which can enhance and inhibit the signals through the modulation, which is involving the neurotransmitter, and through the neurotransmitter not only the dorsal horn but it also involves the neurons transaction or the signals that will be modulated through the neurotransmitter. It's a kind of a chemical that will pass the electrical signals, okay, from one neuron to other neurons. Then ascending pathway, in which the pain signals will be transmitted up to the spinal cord via the various ascending pathway. Primarily it is the spinothalamic tract and to the thalamus of the brain. Okay, so first from the spinothalamic tract, the pain sensation or the electrical impulse is going to the thalamus in the brain, and the brain is detecting that. Okay, so in the thalamic relay, the thalamus will act the relay session, okay, in which the processing and forwarding the pain signals to the appropriate areas in the brain, where the brain will recognize it, and including the somatosensory cortex, limbic system and frontal cortex of the brain. Then the perception of the pain will occur, okay, which is somatosensory cortex. The brain will interpret in the signals as the pain, which will be determining the intensity, location and quality of the pain. How much pain is there, okay, it is very intense or deep pain, okay, whether where it is placed or where it is actually paining, and the quality of the pain, it is very sharp pain or dull pain, okay. So like that these things will be recognized. Then the limbic system will process the emotional response to the pain, influencing how pain is experienced and reacted to. Okay, so our limbic system will start to respond regarding the pain, okay, how the pain is, okay, is the pain sharp or it is dull, okay, and in the last the response will occur, okay. So the brain will formulate different kind of response to different kind of pain, which may include behavioral actions like withdrawing from the painful stimulus, like if one pen is pricking, okay, or one needle is pricked in my hand, okay, what I will do in the reaction of that, I will try to remove that, I will try to remove the particular production of the pain, okay, like whatever the cause of the pain, I will try to withdraw myself from that, okay. Or if it is we are touching a very hot kind of a pot, okay, or vessels, okay, what we will do is we will try to withdraw our hand from that place, okay. So that is the kind of a response, okay, or automatic response, which is increase the heart rate. It is any kind of pain that is like stomach pain, okay, or back pain. And if it is very intense, then what will happen is inside our body we can withdraw it from ourselves, right? So what will happen is our heart rate will be increased, which is a autonomic response of our body. Okay, so this pathway is illustrate how pain is not only a physical response or physical sensation but also an emotional experience, okay, that involves the different kind of complex interaction between the peripheral and central nervous system. Okay, so in the peripheral, in the nervous system, the pain pathway is very important question, and 4 to 6 times it have been come already. Okay, so don't forget to remember this. So next and the last, our last question is function of the testosterone. In the endocrine system, the testosterone is a very plays a very huge role. Okay, so testosterone we mainly can see in the males. Okay, and there are different kind of functions that testosterone plays. Okay, so our first function is development of the male reproductive organs. So testosterone will essential for the development of the male reproductive organs such as testes, scrotum, okay, then development of the penis. Okay, so this will help to develop in the fetal stage, okay, of male. Then we have spermatogenesis. Now what is that? It is stimulates the production of the sperm in the testis and playing a crucial role in the male fertility. Okay, then secondary sexual characteristics such as hardness of the voice, okay, pubic hairs, armpit hairs, okay, and the muscles, okay, making the muscles. The testosterone promotes the development of the secondary sexual characteristic during puberty of a male, okay, such as increased muscle mass, okay, then deepening of the voice and facial and body hair growth. Okay, so these are the main function. Then we will move on to the bone density maintenance. It helps to maintain the bone density or thickness or the concreteness of the bone, and also increasing the strength and reducing the risk of the osteoporosis in men. Then the muscle mass and strength. Okay, the testosterone contributes to increase the muscle mass and strength by promoting the protein synthesis. Okay, it's also help in protein synthesis, so the muscle mass will be increased. Then libido and sexual function, which is it plays a key role in regulating libido, which is the sex drive of a male. Okay, then the mood regulation. The testosterone will influence the mood and cognitive, different kind of cognitive function, the intellectual ability to understand any situation or the complexity of any kind of subject. Okay, and low levels of association with mood disorders like depression. Okay, so it is also involved in the depression. Then the fat distribution. Okay, it affects the body fat distribution. Okay, where in the body where should be, how much fat should be there. Okay, and the promoting a leaner body composition by reducing the fat mass. If the testosterone level is high in a male, okay, so that male or that particular person will have low fat or leaner body. Okay, then the red blood cell production. Okay, the testosterone stimulates the production of the erythropoietin, which is the main important protein which is leading to increase the red blood cell and production of the bone marrow. Okay, so these are the most important question that will definitely come in exam. Okay, I hope you will guys able to understand. Okay, and try to rewind it and read it again and again so you can pass the exam. Thank you for this session. Keep learning and keep exploring with EZI Nurse. Thank you.